Women are often incorrectly told that they are not supposed to have a vaginal birth after a C-section. VBAC stands for vaginal birth after a C-section. Even women who are candidates for a VBAC are often told that they must have a repeat C-section for all future pregnancies. Hello everybody, I am Dr. Arpitha Komanapalli and I'm glad you're watching this video. In this video, I'll be talking about VBAC. Women are often incorrectly told that they are not supposed to have a vaginal birth after a C-section. VBAC stands for vaginal birth after a C-section. Even women who are candidates for a VBAC are often told that they must have a repeat C-section for all future pregnancies. The truth is that medical evidence and even the national guidelines suggest VBAC is a safe, reasonable and appropriate option for most women. In addition, science shows us that women should be given the opportunity to decide for themselves how they want to handle their childbirth. By getting educated about childbirth and more aware of her options, a mother can reduce fear and stay actively involved in the decision-making process throughout her pregnancy, labor and birth. So what is VBAC? Once a woman has a child delivered by C-section, her options for the next pregnancy are either a planned trial of labor or a planned elective repeat cesarean. For many women, a VBAC is the best option, as research shows that 60 to 80% of women who attempt a VBAC have a successful vaginal delivery. Also, VBAC has many benefits. The hormones produced during labor have major benefits. In natural birth, oxytocin is a natural pain reliever. It's also called as the love hormone. It assists the bonding between baby and mother. Oxytocin also helps to shrink the uterus and decrease the chance of postpartum hemorrhaging. Rising estrogen levels prepare the uterus for labor. It promotes breastfeeding postpartum and also it reduces the likelihood of hemorrhaging. During labor, babies also develop catecholamines or stress hormones. These promote breathing. They send blood flow to important organs like heart, brain and kidneys and boost their immunities. Research shows that more effective elimination of fluid from the lungs during a VBAC might also prevent babies from developing allergies and asthma. Vaginal birth also decreases babies' chance of developing type 1 diabetes and obesity later. Perhaps most importantly, VBACs provide the opportunity for a mother to heal emotionally from her previous cesarean. She may gain a sense of personal satisfaction, accomplishment and exhilaration that she never had before. Another major perk of vaginal birth is that baby is seeded with an abundance of beneficial bacteria that could possibly help shape the immune system for a lifetime. During vaginal birth, as the baby travels through the birth canal, the baby is coated in the mother's bacteria. This load of microbes goes into the baby's eyes, ears, up to its nose and into the mouth. Inevitably, the baby swallows some of them too. In the baby's gut, the first bacteria to arrive starts to colonize and multiply. The special breast milk sugars called oligosaccharides are indigestible to the baby, but they are purely to feed the baby's newly seeded bacteria. So this natural seed and feed process is perfectly designed to set up baby's microbiome in an optimal way. Research indicates that this seed and feed process could be critical for the development of infant immune system. Emerging science suggests that first bacteria to arrive in the baby's gut initiate the training of immune system, helping it to identify which bacteria the body should tolerate and which it should attack. Interfering this process could result in incorrect training of baby's immune system, in turn resulting in the immune system attacking beneficial bacteria and tolerating harmful bacteria. So overall, this inadequate training potentially sets a pathway for problems later in a child's life. Just as the baby develops from a newborn to toddler, the baby's microbiome develops over the first few months and years of life until the microbiome stabilizes sometime during early childhood. The biggest fear among women looking into natural VBAC birth is uterine rupture. Statistics show that fewer than 1 in 100 women who have had a lower transverse incision experience a rupture while attempting VBAC. And also, if a uterine rupture does occur, the prognosis is always good, provided if you are in an institution that has in-house obstetric, anesthesia and surgical staff in which close monitoring of the baby and mother is available. Uterine rupture does not result in major maternal morbidity and mortality or in neonatal death. So who is a good candidate or who can attempt a VBAC? A successful VBAC does not depend on the weight of the baby or a previous failure to progress. In fact, some other considerations when thinking about a VBAC include type of surgical incision from previous section, reason for the past cesarean, whether or not there was a previous uterine rupture, mother health issues if any, age of the mother, shape of her uterus, and the presentation of the baby. So here are 7 steps to a successful VBAC. Get mentally prepared. You need to commit to a vaginal birth after a section. By committing to a VBAC, you will set up yourself for a success. Don't let doubt, fear, or peer pressure sway you. You need to keep your mind focused and positive. As part of this, you want to clear any negativity around birth. If your parents, siblings, or friends try to discourage you from VBAC, do not discuss with them. It certainly helps to have their support, but you are the one who needs to believe that you can do this. Get your medical records from your previous C-section. By getting your records, you will be certain why the section occurred and what type of scar you have and any other pertinent information. This will help you to take a decision for a VBAC and help you give you all the information you need to know if you have to choose an emergency section. Pick a caregiver who believes in VBAC. There are plenty of obstetricians and midwives who are committed to providing women with the kind of care they desire or who believe in VBAC. Partnering with a midwife improves your odds for a successful VBAC. Giving birth in a birthing center is an excellent and safe option. If you give birth at home, be sure to stay within 10 to 15 minute drive to a hospital in case of emergency. In case of uterine rupture, it takes over 15 minutes to deliver baby by section, though it is a rare event. If you don't have access to midwifery and you arrive in labor at a hospital that does not support VBAC, know that you can refuse to consent a surgical birth. Get a doula. Hire an experienced doula for labor support. Be sure she's attended several successful VBACs. Her encouragement, steadfastness, and experience will be invaluable during your birth. Doulas tend to help calm and empower partners to be active participants in labor. Make sure to write a birth plan. There's something about putting your birth preferences down in black and white, and it's very powerful. Take care of yourself while pregnant. The chances of successful VBAC are higher when a woman and her baby are healthy and the pregnancy is progressing normally. Take care of yourself throughout your pregnancy. Eat a healthy diet that's based on anti-inflammatory foods like leafy green vegetables, chia seeds, berries, salmon, walnuts. Also, don't forget to stay active and walk often. Most importantly, stay positive about your VBAC and do what's best for you and your baby. Do exercises to help get baby into optimal birthing position. Please watch my pregnancy workout videos for detailed exercises. Avoid labor induction and augmentation. Labor induction is not prohibited in VBAC, but induction can increase the risk of uterine rupture. If there is pressure for you to dilate quickly, then move around, change positions, or get into water if that's available. And also try to resist interventions like epidural or synthetic oxytocin for as long as possible, and ask your caregiver to keep vaginal exams to minimum. It is best to avoid interventions because they increase the risk of needing a section. Epidural side effects like slowing down the labor may lead to more interventions like Pitocin, that is the synthetic oxytocin. Pitocin may cause fast or irregular heartbeat for the mother and serious complications for baby, therefore increasing the chances of delivery by emergency C-section. Also remember the precautions for VBAC. There are some valid reasons for cesarean sections. These include prolapsed cord. when the cord comes down before the baby. Placental abruption, when the placenta separates before birth. Placenta previa, when the placenta partially or completely covers the cervix. Fetal malpresentation, this is when the baby is in breech or in the wrong position. Cephalopelvic disproportion, this is when the baby's head is too large to fit through the pelvis. And mother's medical conditions like severe blood pressure or hypertension, diabetes or active herpes lesions, and most importantly, fetus distress. I hope this information was helpful and you'll be able to take necessary steps. Here is a scripture to meditate upon. God is our refuge and strength, an everlasting present help in trouble. Therefore, we will not fear. Psalm 46:1. Thank you so much for watching this video. If this video was helpful, please share with your family and friends. I'll see you again in my next video.